Your skeleton. Our skeletal system is the framework that supports the body, protects our organs and other body structures, and enables us to move. It is formed from bone and connective tissues. There are 206 bones in all, linked together by a system of joints. Bones are living tissues which form light but strong structures. Many bones have connective tissue called cartilage at their ends, and this reduces friction during movement or connects certain bones such as the ribs and sternum or breastplate. Joints are the structures that connect one bone to another. The joints in the skull and pelvis are fused together, but most other joints allow movement. The bones in these joints are held together by tough fibrous connective tissues called ligaments. The spine consists of 33 vertebrae. These support the head, neck, rib cage, and lower back and form part of the pelvis. The neck and back vertebrae allow bending and twisting. Ligaments hold the vertebrae together, while tough, springy cartilage discs between them act as shock absorbers during movement. We have around 300 bones when we are born, but some of these fuse together as we grow. In movable joints, the bones are connected by ligaments. The bone ends are covered with a layer of tough cartilage so they can move smoothly against each other. They are sealed in a joint capsule filled with fluid, synovial fluid, that lubricates the bone ends. The ball and socket joint is found in shoulders and hips. The end of the limb bone fits into a hollow area of another bone, allowing movement in almost any direction. The pivot joint, one bone fits into a collar formed by the other, allowing the joint to turn as in the neck. The ellipsoidal joint, the end of one bone, fits into a shallow socket in the other to allow twisting as in the wrist. The gliding joint. The flat surfaces in this joint can glide over each other as in the wrist and the ankle. The saddle joint. This joint, found in the thumb, has two curved bones that meet at right angles, allowing the thumb to move in any direction. The hinge joint is found in the elbow and knee. The cylindrical end of one bone fits into a groove on the other, which allows back and forth movements. The skeleton has two main functions. The skull, spine, and ribs protect the organs. The arm and leg bones, plus the shoulder blades, collarbones, and pelvis work with the muscles. To move the body, joints between these bones allow bending and other movements. Thank you for your attention.
Let's now go to identification of patterns. Let's discuss full heat. Hot and cold describe the nature of a pattern, and their clinical manifestations depend on whether they are combined with a full or empty condition. Full heat can be external, as in wind heat, or internal. The manifestations of invasion of wind heat have already been described above. Full heat, whether external or internal, is a manifestation of excess yang. Here we can see the full heat from excess of yang. The main manifestations of full heat in an internal condition are thirst, a feeling of heat, some mental restlessness, red face, dry stool, scanty dark urine, a rapid full pulse, and a red tongue with yellow coating. Beyond this, it is difficult to generalize as other manifestations will depend on the organ affected. Aside from the above clinical manifestations, there are other diagnostic guides which indicate heat. Any raised red skin eruption which feels hot indicates heat. For example, acute urticaria normally takes this form. As for pain, any burning sensation indicates heat. For example, the burning sensation of cystitis or a burning feeling in the stomach. Any loss of blood with large quantities of dark red blood indicates heat in the blood. As far as the mind is concerned, any condition of extreme restlessness or manic behavior indicates heat in the heart. Of course, a subjective feeling of heat also indicates heat. Etiology: internal full heat may derive directly from the excessive consumption of hot energy foods like red meat, spices, and alcohol, or indirectly from emotional stress. In fact, emotional stress tends to cause stagnation in its early stages. If chi stagnates for some time, it usually gives rise to some heat. With further passage of time, heat may turn into fire. Finally, internal full heat may also derive from the transformation of a pathogenic factor which penetrates the interior and turns heat as it does so. Here we can see the etiology of full heat. Full heat. The manifestations: thirst, a feeling of heat, mental restlessness, red face, dry stool, scanty urine, r- rapid full pulse, red tongue with yellow coating. Etiology: emotional problems, diet, too much red meat, spices, and alcohol. An external pathogenic factor that has penetrated into the interior and transformed into heat. A woman of 50 suffered from burning pain in the epigastrium. She also complained of nausea with occasional vomiting, bleeding of the gums, bad breath, thirst, and insomnia. Her tongue was red, had a crack in the center with a sticky dry yellow coating, and was dry. Her pulse was full and slightly rapid. These manifestations indicate full heat in the stomach. Thank you for your attention.
Spleen 17. Shi Tao. Food hole. Spleen 17 is located on the lateral side of the chest in the fifth intercostal space, 6 tune lateral to the anterior midline, level with CV16. Caution, needling. The lung lies below this point. Puncture obliquely and laterally along the intercostal space. Do not needle deeply. Shu Tao, or food hole, can refer to the nipple, which is not far from this point. The spleen is responsible for the distribution of nourishment, and Shi Tao reminds us of this connection. This point can facilitate movement and invigorate the body, mind, and spirit when there is stagnation of spleen qi. The spleen's function of transporting is important in this area of the chest where we receive breath. This point can be used when there is agitation and congestion in the chest. It can be used for pain in the lateral costal area. The transporting aspect of the spleen can be utilized here if there is postpartum abdominal distension and swelling or urinary stoppage. Life pus, an alternative name, reinforces the notion of the transporting of undigested food and fluid accumulations, which, if not cleared, impede the maintenance of life. Indications: lung congestion, lateral intercostal pain, postpartum abdominal distension, and indigestion. Spleen 17 is for someone who feels stuck either in a mental sense, for example, obsessions, or physically, such as feelings of stuckness in the chest area or congestion of the lungs, indicating that the spleen is not transporting properly. Indications and potential point combinations. For back pain in the T5 to T7 paraspinal region, we combine spleen 17 with GB22, 23, and bladder 15. For intercostal neuralgia in the fifth intercostal space region, we combine spleen 17 with bladder 15, 14, GB22, and 23. And for hiccup, spleen 17 is combined with CB22 and 14. Thank you for your attention.
Let's now go to thoughts produced by kidney function, part 2. Let's discuss fear. Through practical observations, the Neijing authors noticed that the emotion of fear was produced by the kidneys, just as whenever the liver function is obstructed and the liver produces the emotion of anger to to remove the obstruction. So when the kidney function is undermined, perhaps some element of our safety or status or a cherished person or thing is threatened, the kidneys produce the emotion of fear to cause us to take urgent action to remedy the situation. This might be to flee from the danger or take evasive action to remove the threat. Fear is produced in two main situations. First, when the kidney function becomes weak. When the kidney function is poor, this makes us less resilient, reduces our stamina, weakens the function of all the organs, as well as reducing the availability of energy generally. All these things are regulated by the kidneys. Hence, any weakness in the kidney function could produce these effects. This places us in a vulnerable state. One of the kidney functions is to want to be alive and continue living. And when we feel vulnerable, this undermines this function. So the kidneys produce the emotion of fear to prompt us to address the situation. This would start as a state of general fearfulness rather than a sudden fright, but it would also be accompanied by a release of adrenaline. This state can be frequently seen in people when they become drained, often through driving themselves too hard. They tend to become jumpy, and their sensitivity to sounds may also become more acute. Hearing is the sense the kidneys are most closely associated with. This is a defensive state. We are made more alert, so we can watch out for danger and are able to respond quickly to it, should we spot it. Ordinarily, this is intended only as a short-term measure, but when this state becomes almost constant, it only weakens the kidneys further through overuse of these emergency reserves. This then only increases our fearfulness, increases our general depletion, and inhibits the good function of all the organs, and all of which diminishes our long-term health. The stage of life when poor kidney function is common is old age, which is why old people are often fearful, which constant state of fearfulness only tends to weaken their kidney function even further. If longevity is a concern of yours, then avoiding fearful situations at all stages of life will be beneficial. Next, we notice a threat. Another of the kidney functions is to produce, set goals for the future, and pursue those goals. This also goes hand in hand with its function to want to be alive and continue living. When we notice anything that threatens our own physical safety, or that our loved ones, or threatens our social position or our achievements, this undermines these kidney functions. In response, the kidneys produce the emotion of fear to prompt us to address the threat, and the degree of fear would reflect the urgency of the threat. In contemporary physiology, the adrenal glands are heavily associated with the flight response. And since the adrenal glands are one of the three kidney related structures, this also supports the associations between fear, flight, self preservation, and the kidneys. The kidney function is also used to process the threatening situation. One part of its function is to recognize threats and find a solution to them. This kidney logic, or in other words, the logic of the immune system, is then used to quickly process the situation and present a solution to our conscious mind. Thank you for your attention.
TCM Nutrition, we discuss foods with warm properties. Foods with warm properties have the effects of warming the spleen and stomach, dispelling cold and invigorating yang. They can also enhance physical power and strengthen the body. These are suitable for people with a relatively cold constitution, deficiency of yang or cold symptoms. They are also suitable for a warm supplement in autumn. The symptoms of a relatively cold body constitution include a tendency toward a plump and less muscular physique, an intolerance of cold temperatures, tendency to have cold limbs, preference for hot food and drink, dispiritedness, and a fat, tender, light-colored tongue. The symptoms of yang deficiency include intolerance of cold temperatures, cold limbs, pale complexion, diarrhea with undigested food, dispiritedness, thin, sloppy stool, and clear, abundant urine. Cold symptoms are uncomfortable symptoms caused by a cold body constitution, such as an intolerance of cold temperature. Recommended food: glutinous rice, sorghum rice, goose eggs, Chinese chives, cumin, coriander, pumpkins, longans, papayas, pomegranates, dark plums, chestnuts, red dates, gingers, walnuts, almonds, chicken, beef, mutton, shrimp, sea cucumbers, garlic, onions, green onions. Thank you for your attention.
Let's now go to integumentary disorders. Let's discuss inspection of skin and hair. Inspect the regional involvement and distribution. Most skin diseases exhibit a preference for area of involvement. The structure, function, and physical nature of the skin in specific body regions are more favorable for some diseases. For example, opposing skin folds favor hidradenitis and candidiasis. Photoexposed area of the head and neck are frequent sites of skin malignancy, such as basal cell carcinoma and squamous cell carcinoma. Areas of heavy follicular distribution, such as the chest and back, are subsequently prone to folliculitis and cystic structures. Here we have here the basal cell carcinoma and the squamous cell carcinoma. Similarly, the term distribution is used in describing skin findings. Terms of distribution commonly used in describing skin disease include generalized, localized, discrete, or confluent. While not always as helpful as a regional approach, certain distribution patterns, such as the localized area of involvement in allergic contact dermatitis, are crucial characteristics of the diagnosis. Terms used to describe distribution patterns include flexor, extensor, and dermatomal. Inspect the hair. Observe color, texture, and distribution. If you find localized alopecia, assess for a scarring versus a non-scarring appearance. Scarring alopecia is caused by diseases that destroy and scar the hair follicles. Smooth, shiny, scarred areas on the scalp with no obvious follicle visible suggest deep inflammatory conditions where the follicles are destroyed, such as discoid lupus, erythematosus, and lichen planus. Non-scarring alopecia found in singular or multiple patches may represent hair breakage, as seen in traction alopecia and trichotillomania. Both result from manipulation. unlike the breakage of hair seen in tinea capitis that is caused by a fungal infection. Chronic conditions such as diffuse androgenic alopecia can develop insidiously during the second or third decade of life, with a telogen effluvium, a generalized hair loss usually related to an internal stressor. Evident hair loss begins 3 months after a stressful encounter. Alopecia areata and its autoimmune cell-mediated problem may affect any hair-bearing surface and usually occurs as 1 to 5 cm round or oval patches of hair loss. Unexplained patchy hair loss, especially at the occiput, should always be evaluated as a secondary finding of syphilis. Thank you for your attention.
Acupuncture for emergencies. This time we discuss acute kidney stone. Acute kidney stones in TCM are understood through the lens of organ function, energy flow, and balance. Weakness in kidney function can lead to the formation of stones. Damp heat accumulation, excess heat and dampness in the body can contribute to stone development. Chi stagnation, blocked energy flow may exacerbate symptoms and lead to pain. Symptoms. Pain is often described as sharp or stabbing, typically in the lower back or abdomen. Urinary issues, difficulty urinating, blood in urine, or frequent urination. Nausea and vomiting are common accompanying symptoms due to pain. Treatment approaches. Formulas may include herbs that promote urination, clear heat, and resolve dampness. For example, Jin Qian Sao, Jik Qian Si. Acupuncture targets specific points to relieve pain and improve kidney function. Dietary adjustments. Emphasis on foods that support kidney health and reduce dampness, such as barley and mung beans. Preventive measures. Drinking adequate water to help flush the kidneys. Avoiding excessive intake of rich, fatty, or spicy foods that may contribute to damp heat. Use the kidney stone point, which is 1 tune above kidney 3. Use acupuncture on the hands, low back pain point. Use stomach 28, kidney 9. Thank you for your attention.
Let's now go to hyperthyroidism. Let's discuss pathology. Hyperthyroidism is an imbalance of metabolism caused by overproduction of the thyroid hormone by the thyroid gland, whereas thyrotoxicosis is defined as the clinical syndrome of hypermetabolism resulting from increased levels of thyroid hormones regardless of their origin. Therefore, thyrotoxicosis may be associated with hyperthyroidism or occur without any hormone synthesis and secretion by the thyroid gland. Such is the case when hormones are released following the autoimmune destruction of the gland, produced by tumors or ingested food or diet products. Pathology. Main causes of hyperthyroidism are Graves' disease, above all in countries with iodine sufficiency status, growth of benign thyroid nodules, toxic adenoma, toxic multinodular goiter, especially in countries with iodine deficiency, or pituitary gland tumors, hypophyseal adenoma, increased thyroid functions due to excessive thyroid stimulating activity of the beta HCG trophoblastic tumors, and hyperemesis gravidarum, conditions leading to thyrotoxicosis without hyperthyroidism include ovarian tumors, struma ovari, inflammation, irritation and swelling, and destruction of the thyroid due to viral infections or other causes like drugs, radiation, bacterial infections, ingestion of excessive amounts of thyroid hormone, ingestion of excessive iodine. Graves' disease accounts for 80% of all cases of hyperthyroidism in countries with insufficient iodine intake. This is the most common cause of hypothyroidism and is due to an autoimmune process. Serum imo- IgG antibodies bind with the thyroid TSH receptor, stimulating thyroid hormone production and behaving like TSH. These TSH receptor antibodies can be measured in serum. Yersinia enterocolitica, as well as Escherichia coli and other gram-negative organisms, contain TSH binding sites. This raises the possibility that the initiating event in the pathogenesis may be an infection with possible molecular mimicry in a genetically susceptible individual, but the precise initiating mechanisms remain unproven in most cases. Thyroid eye disease accompanies the hyperthyroidism in many cases, but other components of Graves' disease, for example, Graves' rarely lymphadenopathy and splenomegaly may occur. Graves' disease is also associated with other autoimmune disorders such as pernicious anemia, vitiligo, and myasthenia gravis. The natural history is one of fluctuation, many patients showing a pattern of alternating relapse and remission. Only about 40% of subjects have a single episode. Many patients eventually become hypothyroid. Thank you for your attention.